53-year-old female presents with acute, painful, hot knee joint. She is known to have rheumatoid arthritis for many years. Her knee is red, tender and swollen. Hamstring muscles are in spasm. Temperature is 38.5 and BP is normal. What is the single best next investigation? Answer is a joint aspiration for culture and sensitivity. You are suspecting a septic arthritis here. Having chronic arthritis puts you at risk of septic joint. Also, needing steroids lowers your immunity. 49-year-old patient has come with an acute gout attack to the emergency department. What drug will be given to relieve the symptoms? So this patient needs NSAIDs orally. You will not give lignocaine patch, which is not going to be effective in this condition. Most patients get better with NSAID for acute symptom management. Subsequently, they may require colchicine or corticosteroids. A young boy fell on his outstretched hand and has presented with pain around the elbow. He has absent radial pulse on the affected side. What is the most likely diagnosis? It will be angulated supracondylar fracture, choice B. Now, falling on an outstretched hand can give rise to many types of fracture, right starting from the fracture of clavicle, radius, or even the wrist injuries. However, it says here that the radial pulse is not felt, which is a common complication in supracondylar fracture, almost a classic scenario. What happens is that the distal humerus is displaced posteriorly, causing vascular compression. 3-year-old child has been brought with facial lacerations. On examination, he has some cuts over the right cheek and under the eye. GCS is 15. What is the next best investigation? So this patient needs special views for facial X-ray. There is no indication of head injury, so you don't need skull X-ray, CT scan or MRI. With the cheek over the zygoma bone, a hematoma can form, and you want to know that if a bone is broken by a facial X-ray. There's no point in observing. 24-year-old man is stabbed in the chest and brought to the emergency department. Chest is bilaterally clear with muffled heart sounds. Blood pressure is 66 systolic. Pulse is 120 beats per minute. JVP is raised. What is the most likely diagnosis? This patient will have cardiac tamponade. Chest is clear, so there is no reduced air entry on either side, and there is no indication of dullness. So there is no pneumothorax and no pulmonary, no hemothorax. You cannot say just simple pericardial effusion because there is so much pressure from the tamponade that the blood pressure is falling, there is tachycardia and JVP is elevated. A 24-year-old biker has been rescued after being trapped under rocks for almost 12 hours. He complains of reddish-brown urine. His creatinine is 350 unit moles per liter and his urea is 15 millimoles per liter. What is the most important step in this management? Patient needs IV normal saline. Because of trauma and muscle injury, he now has rhabdomyolysis and hence this color of urine, which is reddish brown. He needs hydration with normal saline, otherwise he will develop renal toxicity. Yes, it is always good to refresh the topics that you found tricky. Spend a few minutes reading around those topics that you know less about. Finally guys, leave a comment or press a like button to encourage us to upload more videos like these.